how to score the SEEK. In this video, we will cover how to score the safe environment for every kid, how to use the SEEK algorithms, address barriers, and how SEEK parent handouts round out implementing the SEEK into your practice. The SEEK begins with a paragraph that emphasizes that parenting is not always easy and sets a tone of empathy and caring about the caregiver and family. It also notes that the SEEK is a voluntary screen and that caregivers do not have to answer any questions. The questionnaire itself is 16 yes or no items. So how do you go about determining whether a SEEK screen is positive? The creators of the SEEK do use the language of a positive or negative screen, but we do not recommend using the language of a quote positive screen, rather indicating there are some things we can discuss more to support you and or your family. A positive screen for food insecurity requires a yes to either of the questions. In the past 12 months, did you worry that your food would run out before you could buy more? Or in the past 12 months, did the food you bought just not last and you didn't have money to get more? For harsh punishment, a positive screen requires a yes to either of the questions. Do you sometimes find you need to slap or hit your child? Or do you often feel your child is difficult to take care of? For major stress, a positive screen requires a yes to any of the questions. Do you feel your child is difficult to take care of? Or do you wish you had more help with your child? Or do you often feel under extreme stress? For intimate partner violence, a positive screen requires a yes to either of the questions. Have you and your partner fought a lot? Or has a partner threatened, shoved, hit, or kicked you, or hurt you physically in any way? For substance abuse, a positive screen requires a yes to either question. Have you had 4 or more drinks in one day? Or have you used an illegal substance or prescription medicine for non-medical reasons? For depression, a positive screen requires a yes on either of the PHQ-2 items. Over the past 2 weeks, have you often felt down, depressed, or hopeless? Or, over the past 2 weeks, have you felt little interest or pleasure in doing things? Importantly, if a yes is endorsed for either of the PHQ-2 items, Louisiana Medicaid does require follow-up with a full PHQ-9 for reimbursement of perinatal depression screening. Once a caregiver has completed the screen, the primary healthcare provider can use the algorithms in addressing barrier sheets while reviewing the results with the caregiver. Fortunately, the SEEK has developed algorithms for each topic that is assessed. Similar to other algorithms, you work your way from the top to the bottom. For example, here's a summary of what the algorithm looks like for major stress. It includes language such as, I see you've been really stressed out, sounds like it has been rough, and encourages information gathering for the context and areas in which referral or intervention might be beneficial. So please tell me about your stress. How is this affecting you, your family? How are you dealing with this? What else could you try? Are you getting help? Who or what's helping? Then asking the specific question, would you like help or would you like more help than what you're already receiving? If the answer is yes, what kind of help would you consider? And then the algorithm allows for documentation of a referral being given, reassurance being provided, or follow-up at a next appointment and other options. If the caregiver says no, asking, what makes it hard to get help? What can make it easier to get help? These questions often lead to caregivers discussing what barriers they are currently facing and where the addressing barrier sheets come in handy. The Seek developers created this complement to the algorithms so that providers are prepared to help answer frequent questions and address common barriers. For each barrier, such as, I don't know where to get help, I tried getting help before but it didn't work, I don't want to be on medication, or I don't have childcare. There are several recommended statements that are based in motivational interviewing techniques and include empathetic and reflective statements. These statements may help lead to problem-solving solutions together or prompt discussion of the parent handouts or other resources. Last but not least, the third component of Seek is the parent handouts. The parent handouts are currently in both English and Spanish and are entirely customizable. You can adapt these handouts with information from our developmental screening resource guides, particularly the one for family wellness. BFH is also happy to help connect you to others who can identify local resources, whether it be the Family Resource Center or other local organizations that can provide those direct referral connections. Looking at the Major Stress Parent handout, we can see that it is grounded in empathy and understanding. The handout then describes what major stress might look like physically, emotionally, and behaviorally. Similarly, the handout includes helpful tips and national resources. Because all of the handouts come with national resources, it is important to make sure they are updated and customized to your local area and patient population. If you want to learn more about the Seek and how to implement it into your practice, check out the description box below for important links, such as our Barriers to Health training page, the Louisiana Medicaid Bulletin on reimbursement for general development, autism, and perinatal depression screening, as well as the Seek website. You can also check out our videos on the basics of the Seek and using developmental screening resource guides with families.